People are afraid to take statins because they hear influencers say statins cause dementia. In fact, they don't. If you look at this study, which is a compilation of 36 studies done by the Cochrane Review, they found actually that there was a 20% reduction in Alzheimer's and dementia among those taking the latest fourth generation statins. 20% reduction. Why is that? Because statins reduce atherosclerosis. Now you'll hear people say, well, wait a second, your brain needs cholesterol. But do you know that your brain makes its own cholesterol? It doesn't get its cholesterol from the cholesterol that's in your blood. But the cholesterol in your blood, if it increases, leads to something called atherosclerosis. Specifically, a protein on low-density lipoprotein causes the cholesterol to be brought into the blood vessel and dumped there, leading to atherosclerosis. And we can see these changes in very young people, but they accumulate over time, just like a sink accumulates stuff over time, and ultimately you have to have a plumber come in and fix it. Statins prevent that by decreasing low-density lipoprotein, or the apoprotein B. They decrease the risk of peripheral vascular disease, or atherosclerosis, which means less heart disease, less strokes, less peripheral vascular disease, less blindness, less kidney failure, and less dementia. Why? Because the second most common cause of dementia, which is what my mother had, is vascular dementia. And that is directly mitigated by atherosclerotic disease, which occurs in the brain. Had my mother taken statins, she would probably be alive to this day and probably not have gone through that horrible time she did with dementia. So when you hear people say statins cause dementia, and all these people have dementia who are on statins, remember, when it's been looked at critically, that is not the case. In fact, statins decrease the risk of dementia. Here's a couple of other little facts that you might want to know. Your brain makes its most cholesterol in your first 20 years of life and then holds on to it. It isn't taking more cholesterol in, it simply makes its own. When you are a young person like my son, who's 13, who's developing his brain and younger, if you were to measure his LDL, low density lipoprotein, it's below 50. As we age, more genetics takes hold, people's low density lipoprotein tends to go up. We can absolutely decrease the risk of heart disease, probably bring it down to zero. Then I'll hear people say, oh my gosh, if heart disease and all these statins, why isn't heart disease zero now? Well, we've actually cut heart disease in half since the introduction of statins. It's still the number one killer. There's still a lot of room to go. But statins do not cause dementia. And those people who are saying it and preventing you from taking that statin, they're putting you at risk. So please check with your own cardiologist first. Let them help you decide what would be best for you. If you can't tolerate statins, about 3% of people don't, there are other drugs. But we really want to drive low-density lipoprotein down, because if we do that, we decrease the risk of all of those bad diseases. The other thing they'll say is, well, you need the cholesterol to make all of your hormones, your testosterone. Those gonads, whether they're ovaries or their testicles, whatever, if they're active, they make those by making their own cholesterol. And statins have been checked, and guess what? People who are on statins do not have lower testosterone. They do not have lower estrogens. They do not have lower cortisols. And here's the other thing that statins will prevent: a form of erectile dysfunction. So guys, think about it. You want to keep using it. You don't want atherosclerosis to build up in those small arteries.